Steve, triage, rule out abruption. What do we do?
For traumas and MVAs, most importantly, you want to rule out abruption. The first thing you should do is get the fetal heart tone and then continue prolonged monitoring. You want to perform an ultrasound to rule out abruption, although it's not always obvious in the ultrasound. You want to know maternal RH type. Labs that you would send a CBC and a type. Depending on the clinical situation, you can send coags. Traditionally, we would send a D-dimer and fibrinogen, but these are not always helpful in pregnancy. Abruption of no is a clinical diagnosis, so it's important to look at the tachometer and fetal heart tracing. But as part of the workup, as we said, ultrasound and labs are included. And of course, most importantly, you want to know if there's vaginal bleeding. Lastly, if there's been direct abdominal trauma, you want to do 23-hour obs. If there's no direct abdominal trauma, you want to do 6 hours of obs. And when there's contractions, with or without abdominal trauma, you want to also continue monitoring.
For 23 hours.
For 23-hour obs.